I'm a cornea and cataract specialist. So what I specialize in is basically the anterior part of the eye. The cornea, which is the front dome of the eye, can have diseases or need surgery, even refractive surgery. So I specialize in that type of surgical as well as medical management and cataract surgery, which can entail multifocal lenses, toric lenses, correction for near and distance, as well as laser vision correction using the laser for cataract surgery. Well, I actually was not going into ophthalmology in medical school. I was, in fact, I had never even seen an eye doctor until I'd gotten to medical school. I was thankfully blessed with good vision, but I was going into neurology, and by divine intervention, I got into a one-week rotation for ophthalmology and realized how incredible a field it was, how many people it could help. The surgery was fantastic, and also most of it was outpatient, so it allowed for a family life, which I'd wanted to be able to have a family and not spend 16 hours a day at the hospital. And with ophthalmology, I'm able to see a lot of people and help a lot of people, but also be able to come home to a family at a reasonable time, and my kids know who I am. Well, I try to take a very patient-centric approach. I try to make decisions for patients, whether they're ready for surgery, based upon what I would do for my own family. And I try to discuss with the patients and find out what they're looking for, make sure their expectations are on par with what we can do, and make sure that we offer them a couple options. And sometimes the best option is doing nothing. And I tell people that very often and say, look, your best option is not to do anything right now, to wait a while. Some technology is down the road, or I don't think you're ready for this. And I think that the patients appreciate that, because nobody wants to be sold on anything or pushed into anything. And I make the patients pretty much tell me that they're ready to go forward with something, especially surgically, because that's a scary thing. It's a big deal. And we want to make sure that they are making the right decisions. And often I'll tell folks, go home and think about this, pray about this, and make sure it's the right decision for you. And you can call us back. So there's no pressure for doing anything. Well, I love the satisfaction of really helping people out. The great thing about ophthalmology and what I do, whether it's doing LASIK or cataract surgery, is that the improvement is often instantaneous, or within 24 hours. People come back in the next day and say, I'm seeing so much better already. And you can really see them light up and tell that I've made a difference in their life by the surgery. And that's so rewarding. It's great to see people that already are doing better and are happier based upon their vision, which is such an incredibly important part of our lives. And if you don't think so, have an eye problem, and then you realize how important it is. So I really take a lot of joy in being able to help people out like that. Well, I think you have got the widest array of specialists in ophthalmology in really lower Alabama, and even up until you get to Birmingham probably. And I think we even rival the quality of care you get in Birmingham and at UAB. Having trained there, I can really say that. But we have an incredible array of specialists in essentially all fields of ophthalmology that are not only incredible clinicians, surgeons, but they're also extremely ethical, and that's the most important thing. They make good clinical decisions. Nobody rushes anyone into surgery or pushes them that direction. We all take a very conservative approach, and that's where you're going to find your best surgeons, because all of my colleagues, and I say this honestly, are incredible surgeons. And I've like I said, I've been to Oklahoma and at UAB, and I've seen incredible surgeons, and we really do have those guys, but they're also incredible people too, and they do a fantastic job. And everyone in our group I would have no hesitation in sending my family to them, which is really the question we asking of ourselves. Would you send your mom to this person? And everybody in this group, I absolutely would. The breadth of what I do really consists of cornea transplants, partial and full thickness cornea transplants, pterygium surgeries, which are growths upon the eye from years of sun damage, as well as the advanced cataract surgery and LASIK. All those options, as far as our group go, we have the widest array of specialized cornea physicians in this area using the latest technology. The cataract surgery that we do is highly advanced technology. Options are available. Not everyone decides to go with those options, and that's fine. You know, a lot of our cataract surgery is standard cataract surgery, traditional cataract surgery, still very efficient and very good results. But there's options there for folks that want to utilize that new technology. We've got that at our disposal.